All right, where am I? Let me see if I get this correct. Okay, so I'm gonna be starting this basically as like a review for myself, and then it could also help others. I would assume. These are common instruments. They're not in any order or any like specific specialty. They're kind of like all over the place, but they're common and you should know them. Yeah. So basically, what I'm going to say, I'm going to show you the instrument, give you any nicknames that it may have, and what it's used for. And that's pretty much it. Not really too much to it. Some categories are retracting and exposing, suturing and stapling, cutting and dissecting, suctioning and aspirating, grasping and holding. Okay. The first one is a deeper retractor. It's really a big retractor. It's shaped like a question mark. It is handheld. It comes in different sizes and its use is for deep retraction of organs and viscera. You can tell by like the instrument itself that it's gonna go deep. So next is the spring retractor. It is self-retaining and it is also penetrating. If you look right here, you could see that it's pointy. So you know that's gonna be penetrating some like soft tissues. Yeah. So basically it would you could like push the ends together and then you place it where you need it and then with the spring action it'll give you expose it in a way. Next is the wheat laner retractor. It is self-retaining, meaning that you're not going to have to hold it there. It's going to hold itself with the ratchet mechanism it has. Right here, you could see where it'll lock into whatever place you want it to be, and then you can release it and readjust or remove it. It holds open wound edges. And most of these are going to be superficial and hold open incisions or wound edges. Next is a Volkmann retractor. It's shaped like a rake. I always want to call it rake retractor, and I forget that it actually has a regular name, Volkmann. It could also be called the Israeli. I don't know how to pronounce that, but Israeli retractor. I like to call it rake retractor. It is handheld. You can remember it by having, well, just the rake in general, or it's a teardrop design right here. So it's handheld. It's a superficial retraction of wound edges. You can tell by the tip, like it's short, so it's going to be more superficial. Next is the Graves vaginal speculum, also called the duckbill speculum, and it looks like a duckbill. Or bivalve speculum, there's two, so that's why it's bi. It is self-retaining. It retracts the anterior and posterior vaginal walls. There's like a little bolt mechanism right here that you could tighten and place it however you kind of want it. Now here's a cool one, the Belfour retractor. It is also called the self-retaining retractor. It is self-retaining. It retracts the large abdominal wound, and you can kind of tell by like it's a lot bigger than the other ones, so it's going to go deeper. That's kind of how you memorize the different layers that a retractor would like manipulate how big it is. The thing about this, it comes in different parts, so you could get this right here by itself, and you could use it by yourself too as a handheld retractor. It comes with this other mechanism, or however you call it. It also comes with clips that are interchangeable. I mean, some of them do. I noticed that others don't, but there should be short doubles of these or long versions of these clips right here that you could stick on. So it would be 1, 2, 3, 4, and then the other size 5, 6 as a count. So you're gonna have to count that those are all outside of the body. And then also the bolts. There should be a bolt right here for this adjustment, and this side, I believe. So you could adjust this, move this side closer, you know? So yeah. So it's 6 pieces with 2 bolts. Next is the goulette retractor. It is also called a bolt retractor. It is handheld. It is used for the retraction of small superficial incisions. You can tell right here one end is longer than the other, which allows it to go a little deeper, but it's a pretty small tool, so it's not going to go deep. It's not going to go too deep. It's going to stay more superficial. Next is the Richardson retractor, also called the Rich retractor. Another one, it is handheld. It's going to be used for the retraction of shallow wound edges. But this would probably be better to hold. I think the tips are different if you compare them. Yeah. And then is a large Surgi clip applier. So now we're done with retractors. This is used for stapling. It is also called the hemo clip or the Liga clip. It occludes vessels or other tubular structures. Yep. Nothing too crazy. Next is the Yanker suction tip, also called the tonsil suction tip or oral suction tip. I got this picture because it shows more. You can see all the holes in it. But yeah, this is suctions of all types of wounds without aspiration damage to surrounding tissues. This is probably the one you're gonna see the most. Next is the Style Lure Ronger. Sorry if I'm mispronouncing it, but it's also called a straight ronger or largemouth ronger. It is used to grasp, bite, and detach large amounts of tissue or bone. And when your surgeon is using this, you want to have a moist lap ready in case you want to remove any chunks or of the sort. He could drop them in there, place them somewhere else. Probably be used as a specimen. Otherwise, you just ask. But yeah, I don't know how to pronounce Style Lure Ronger. It's double, what is it called? Double action. So it's better strength. Next is number 3 long knife handle in the cutting and dissecting section. It is also called long knife, long handle, long scalpel. It's used for deep wounds. It's a long knife handle. You typically, anything long is going to go deep. It holds blades 10, 11, 12, and 15. If you already know the number 3 knife handle, the regular one, it's the same thing, just longer. Next is a Sims uterine curette, also called the Sharp curette. It is good for scraping the endocervical and endometrial lining of the uterus during a D&C procedure. Oh, let me see the exact. What is it? It's dilation and curettage procedure. If you wanted to know exactly what that meant. Next, everybody knows these, especially if you're a CNA or you want it to be a nurse. The Lister bandage scissors, also called bandage scissors. They're for cutting, dressing, drapes, etc. It could also be used in C-section to open the uterus without harming the body. Next are these little guys. They're really tiny. You could tell by the tips right there, they're tiny. Joseph scissors. So if they're tiny, what do you expect it to cut? Fine and superficial tissues. Right, next we got the needle holders. We got 3 of them. Starting with the Cryolwood needle holder. This is a fine needle holder, fine needle driver. It is used for holding delicate to intermediate sized needles. You won't really be able to see it, but if you look at it in person, the tip is going to be more fine than the following one, which is used for heavier sutures, heavier needles. So yeah, and it has a crosshatch design on the inside. So cryo wood needle holder. And next is the next one, Mayo Hager needle holder, the heavy needle driver. And like I said, the tip is a lot more broad and it's going to be used for holding heavy needles when suturing. Now, I like these a lot. These are the Castroviejo needle holders, also called the Castrol needle holder. It is for holding fine, oh, I did a error, fine suture needles, F-I-N-E. An example is double-armed Prolene for vascular. And you can tell by the tip. That's a lot thinner and more, just, you could tell it's used for a more finer suture than the more fine needle than the other ones that I just showed you. Next is this, the Forster sponge forceps, also called Fletcher sponge forceps, sponge stick forceps, ring forceps. They're used for grasping delicate tissues, or what more commonly you'll remember them for is a sponge stick. Basically, you fold up there's multiple ways to do it, but you could fold up a Raytech and put it between here and lock it, and you got something used for absorbing blood and blunt dissection. But you should be learning that. Next, you got the plain tissue forceps, also called the Semken dressing forceps, smooth forceps, tissue forceps without teeth. They are age traumatic, so they're going to be grasping delicate tissue and any dressing applications. Usually if they don't have teeth, they're for delicate tissues. Next is the counterpart, tooth tissue forceps, also called Semken tissue forceps, rat tooth tissue forceps with teeth. And it's a 2x1, there are interlocking teeth right here. So when you close it, they like close together. They're used for grasping moderate to heavy tissue. You'll remember that because it has teeth, and used for wound closure. Next is the Gemini forceps. You remember these by their 90-degree angle, also called right angle forceps, Leahy forceps, mixture forceps. They have serrations that go all the way down. Used for clamping vessels, or could also be used for placing a tie or vessel loop, another error. I think it's or it's vessel loop under and around a tubular structure. You can tell with the 90-degree angle, you're kind of able to go like around things better. Yeah, 90-degree angle, don't forget that. Right angle forceps, 90-degree angle. And then these are the Adson tonsil Schnitt forceps. Over here, they're also called tonsil Schnitt forceps, fancy clamp, tonsil forceps, TNA. These have serrations that go only halfway. It has a slight curve right here. They're used for clamping small vessels in a deep wound. They could also hold tonsil sponges, just lock it. And they could also be used for a tie on a passer. Next is the Schroeder tenaculum, also known as a single tooth tenaculum or Braun tenaculum. They have the single tooth right here. They're used for grasping the anterior lip of the cervix. And there's other things it's used for, but that's kind of a common thing. And finally, we have the Leahy traction forceps. These kind of scary looking. And for a reason, they are used for grasping and holding the thick tissues. They could be dull. They could be sharp. Lots of them could be dull or sharp. but the design is the same. Yeah, you can just tell by looking at it. That's definitely for thick tissues. And that's it. That is all, and now I gotta continue studying on my own to see if I can memorize this.